Welcome to this week's edition of the Ozarks Medical Center Medical Minute. I'm Jim Lambert. Today, we're going to be speaking with Dr. Magdy Giurgius on the topic of obesity. Thank you for joining us today. Can you go ahead and introduce yourself to the audience?
So thanks for having me. My name is Magdy Giurgius. I'm a general and bariatric surgeon, and I'm fellowship trained in minimally invasive and bariatric surgery. I work for Ozarks Medical Center, and I have no financial disclosures with regard to this topic.
Again, thank you for joining us. So let's go ahead and start things off and let's talk about obesity as a disease.
So that's a very good question. Obesity is considered by lots of people as a stigma. And unfortunately, it is being understated or underestimated. Obesity, it is a chronic disease, and it does affect every organ in the body and every system in the body. So viewing obesity as a disease will make it easier to diagnose and probably easier to treat and accommodate patients as well.
Now, with obesity being a problem as it is in this country, but not only this country, around the world, what are some options?
So first of all, we have to exhaust the non-surgical options first. We'll talk about lifestyle modifications, diet and exercise. The journey starts by the primary care provider office where they advise patients to lose weight. Then they may entertain the idea of appetizer suppressants where they suppress the appetite. And if the patient didn't achieve what they need to achieve, probably surgical options would be the way to go.
Now, as we continue to discuss about obesity, what about children? We're seeing a growing number of children facing obesity.
I think it's very important to realize the culture change. So educating our children early on how to eat healthier. And there is a misconception that healthier food is necessarily an expensive food, which is not true. I think appropriate choices, dad and mom can invest in their children and become a healthier environment for everyone. I think that's very important. The other thing is we need to know that 1 out of 5 children between the age of 6 and 19 are between obese and overweight in this country. So we have to be very cautious about that.
For a long time, we were told to, eat less and move more, but it's really not that simple, is it?
It is not, and the reason because that there is the metabolic activities in our bodies are different from one person to the other. You can see a person doesn't eat much, but they're still gaining weight. Others whom they are eating a lot and they are not gaining as much as the first person. So I think there is a balance and there is a multifactorial approach for obesity. We need to understand it's not only the individual's responsibility, it's a cultural, it's environmental, it's behavioral, it's genetic, it's a lot of things. It's primary care providers, specialties, responsibilities that we should accommodate obese patients.
Thank you very much for your time today.
Absolutely, you're welcome.